Good afternoon, guys. We get asked this question quite a lot. What is the most effective method of testosterone replacement therapy? Now, as you know, I'm a big advocate of HCG alongside testosterone, or should I say testosterone alongside HCG. So if the premise of TRT is hormone replacement therapy, we know that testosterone suppresses the pituitary, ergo we use HCG to mimic luteinizing hormone to maintain testicular function and supplement with testosterone to optimize male androgen levels. But which of the testosterone preparations is the most effective? The testosterone molecule is the same irrespective of the ester attached to the testosterone molecule. So testosterone is testosterone. But what's actually important alongside this obvious fact is how the testosterone is absorbed and how the testosterone is metabolized. Let's address absorption first. I am a big advocate of subcutaneous injections. I've spoken about this in a previous video, but just very briefly. It's less painful and it leads to lower estrogen numbers. So we have a propensity to aromatization, so we want to minimize that. Sub-Q appears to be the most effective method of doing that alongside more frequent injections. Now, does the choice of ester affect absorption in the subcutaneous tissue? The answer to that question is 100% yes. Now, there are two variables. There's the carrier oil and the preservative. Why do we choose testosterone cypionate as our gold standard? It's a short-acting ester. The carrier oil is olive oil. Some might say it's heart healthy. I'm joking. But it's very fluid in comparison to the other esters and blends, and it has a small concentration of benzoyl alcohol, which is a preservative, and it's very well tolerated. Why did we make the switch from testosterone enanthate to testosterone cypionate? The answer to that question is Brexit made us rethink how we were going to deliver gold standard care, and we came across a manufacturer of cypionate in Europe. So after a lot of work, we managed to gain acceptance from the MHRA to import it for our patients. We have had great success using cypionate subcutaneously. So, switching guys from enanthate to cypionate, what have our experiences been? We were finding that enanthate was causing painful lumps in a small minority of patients. However, it actually presented a big problem. Painful, lumps, predisposing to infection, potential infection, and decreased absorption. Now, the decreased absorption is what is of interest to this discussion. Now, in part, it's obviously the carrier, so if it's more fluid, it's more likely to get into the capillaries and lymphatic system. However, it's more likely that it's the preservative. Now, the preservative in enanthate is chlorobutanol. Its level is about 5%. It's known to be irritative at a level of 0.5%. So in enanthate, it's 5%. So it wasn't very well tolerated sub-Q. Now, there's lots of research to suggest that it is. However, from our experience, a number of guys were complaining of painful hard lumps, and they were not seeing the same numbers that they saw when they were injecting intramuscularly. So, was it an effective method of achieving normal levels? Yes and no, for the reasons just discussed. So moving over to cypionate, which was far more fluid and had less of an irritative effect because it only had a small concentration of benzoyl alcohol, has seen very positive results. It's actually seen an increase in testosterone numbers compared to enanthate for that very reason. And conversely, when switching from cypionate to enanthate, we have seen a drop in testosterone levels. Now, why did somebody switch from testosterone cypionate to testosterone enanthate? And the answer to that question is because the NHS agreed to prescribe their testosterone. So, it's all about profit. No, it's not all about profit. It's all about patient care. So we were delighted that our patient had our letter accepted and his concerns and problems addressed, and he now has his blood tests and his testosterone enanthate prescribed under the NHS. He's quite disappointed because obviously when he switched over he was very happy and his numbers were great. So switching from cypionate to enanthate has caused a drop in his testosterone levels. So we are now titrating them back up. So it's your choice. Money versus efficacy. It's up to you. So a lot of guys do tolerate enanthate subcutaneously, but it can lead hard, painful lumps, causing decreased absorption and leaving the potential for a mild cellulitis and potentially an abscess. So it's not something to be sniffed at. Is that the right phrase? Sniffed at? Yeah, I think so. As for other methods, the gel, unbound, so short half-life, waste of time. So I do have a few guys on the gel, but I have them on the gel alongside HCG. So again, this premise of hormone replacement therapy, the HCG provides the base and we are simply topping up with testosterone gel. It's actually quite effective, and it's quite effective for that reason, and the fact that when you think about hormone replacement therapy and the natural diurnal variation, you want to achieve stable levels and have a little spike. So the testosterone gel can do that for you. Testosterone cream, not interested. For the reasons discussed ad nauseum, short half-life, drop in SHBG, having to use 100 milligrams twice a day or 200 milligrams twice a day to achieve stable levels. No, give me strength. Testosterone, very effective intramuscularly from a numbers perspective, not very effective from a control perspective. As I've said numerous times before, if you're going to inject Testosterone, I would advise every other day injections or daily injections. Testosterone is notoriously painful, causing something called post-injection pain. Why does it cause that? It's because it's got a very high benzoyl alcohol content. So some people do tolerate it, but a lot of people complain of really bad post-injection pain, and they always have problems with estrogen, invariably, unless you prescribe it properly, which is either daily, especially if you've got low SHBG, or every other day if you've got a normal SHBG. Libido, everybody knows about libido. It's as per UK every 12 weeks. There's loads of data to suggest that your levels return to baseline. 10 weeks, a little bit less. 8 weeks isn't actually a bad protocol, but it's not a good protocol, and it's a nasty castor oil, and it's often a very painful injection. 4 mils into your buttocks using either a blue or green. Yikes, horrible stuff. I do have a couple of patients on the Bday. One's on 125 every week and one's on 250 every 2 weeks, and both of them are super stable. The disadvantage, irrespective of achieving stability, is side effects. So if you have an elevated E2 or your levels aren't optimal, that titration is a pain in the bottom, literally, because the half-life of Bday is about 30 days, so you're about 180 days to actually get stable levels. So if you've gone on a proper dose and you've had a negative effect, then you can adjust the dose, but it's going to take 180 days, so almost 6 months to actually achieve stable levels. So yeah, not a very good option for testosterone replacement therapy if you want to think about it as hormone optimization, and realize the importance of biological individuality. And my needs are different to your needs, my requirements, my genetics, my physiology. Ergo, you want to have a TRT protocol that is specifically tailored to your individual needs. Makes sense, doesn't it? What else? Prop. It's not really, it's only abused by athletes because it's got a super short half-life and it can get out of their system before competition time. Yeah, I know a few people who do that. Not under my care. But yeah, we all I hear so many stories about famous athletes, all from reputable sources. Yeah, so prop is the testosterone ester of choice for people who want to abuse testosterone, especially in the athletic community and fighting and all sorts. What else? What other esters are there? Pellets, fuck off, give me a break. Patches, give me a break. Oral, yeah, first pass metabolism, titrating your level, appreciating biological individuality. That doesn't make sense. Can it work? Can all of these preparations work? And the answer to that question is yes. However, true hormone optimization requires subtle adjustments to achieve your optimal levels to maintain long-term physical and psychological well-being. And that can only be done by somebody who knows what they're doing. Just keep increasing the dose. Your estrogens will balance out. Give me strength. So, what is the most effective testosterone ester on the market? Is that the right phrase? What's the most effective testosterone? Testosterone cypionate alongside HCG, only at the Men's Health Clinic.